Okay, we're currently recording a little bit late. So, we have 15 minutes. So the way today's going to go, since we have such a big class, we have 15 minutes to take the quiz. The quiz should all be available to you. You can't quite start it yet until I give you the code. So I was just waiting to get as many people in. We'll take 15 minutes. So we'll probably start in a couple of minutes here, which will be about 4:10. So you have till 4:25 to take it. And then we'll come back, or 25, and then we'll go through the quiz. You'll see in your quizzes that you have rationales for correct answers and incorrect answers. So that's real helpful. And then after that, we'll go through the quiz and I'll do a whole bunch of lecturing and teaching from the quiz rationales, since it introduces the concepts we're covering this week, which is migrant farm workers, rural populations, homelessness, and poverty. Okay, and then I'll be going through my notes to make sure I'm covering everything. Okay. After that, I have a case study that we will do. We have quite a bit of people. I'll probably break you out into 3 breakout rooms, and the
Oh, I
case,
guess we're supposed to log on to the other person class.
excuse me?
What's her meeting ID?
We'll do a case study, migrant population case study. So I have to decide whether I want to break you all out into 3 breakout rooms, and there's 3 questions in the case study, and room 1 answers question 1, room 2 answers question 2, room 3 answers question 3. So I'll sort that out as we go. So what I'd like to do, okay, here comes some other people. So the only ones we're missing is Cepeda and Mercer. Does anybody have any means to get in touch with those 2 students? I don't know whether if they're looking for the Zoom, which would have been in your announcements. All right, let me put a couple, don't start the quiz yet, but I'm gonna put a couple. Okay, Cepeda, you're here. So the only one we're missing is Renia Mercer. Okay. All right. No, I didn't mean that. Code. Don't put them in yet. Just hang tight. Community, whoops, 24. Okay, so I know I sent it to everyone, but this code in your chat that says Community 24, that is for Professor Kershaw's students. And then I just put my students, it's my last name. So let's agree to get started on the quiz. If you pulled it up before 4 o'clock, you're going to need to refresh. Okay. And then put your code in. Professor Kershaw's is Community 24. Mine is Marvel. So make sure everybody put themselves on mute, please. And then go ahead and get the quiz started. I'm going to mute myself. So any questions you have, please put in the chat. And you do have to stay on camera for the quiz. If you want to go off camera, if you finish early, but we need to be back no later than 4:25, but don't log off. Okay, so let's make sure everybody's muted. Again, I'm going to mute myself so I don't bother you guys, but everybody needs to be on camera. All right. All right. Good luck, and I'll see you in a couple of minutes. I'm going to mute myself.
I'm having issues to getting in. You said
Please put your message in the chat. Others are taking the quiz. Okay. Okay, if everybody could start coming on camera. No. Okay. Okay, how'd you do? Did okay?
You're okay.
Okay. So hopefully, each week you are reviewing the few things sent out in the weekly weekend announcement. The concept recordings, are those helpful? The concept recordings that are being sent out?
I found that your video was
Yeah.
very helpful for the test today.
Pardon me?
I said your video was very helpful for the quiz today.
Awesome, awesome, great. So if you're reviewing the concept recordings, if you're reviewing the readings that you're assigned to, and then having a look at the PowerPoint, you should be okay for these quizzes. You know, you got to do the prep work, because we develop our own quizzes, and when I go back and develop quizzes, I do it from your readings and the concept recordings. So if you're doing all that, you should be doing fine in your quizzes, right? The other thing about the quizzes too, did you see the rationales? Are you
Yes.
liking the rationales?
Yes.
Yes.
Yeah. That's been a new addition this term that I really believe will help when we go through the questions, but don't forget, when you're preparing for the exams, you also can go back and look at the rationales, right? So don't forget you have that as an additional resource. Okay. So a week from today, you guys will be taking exam 1. We've already had one review session, Wednesday, with Professor Ford. For Professor Kershaw students and mine, I've already posted that recording in your announcements. Did you see that? Okay, so that's there. I'm doing a exam review after class today. Okay, that's the second one, and you'll get the recording tonight or first thing in the morning. And then Professor Kershaw we'll have our last exam review, and that will be Sunday night. And you'll get a recording of that if you can't attend live. So you have 3 recordings, okay, for the preparation for exam next week. Okay.
Do you know what time Sunday Professor Kershaw is going to have her?
Well, 7 p.m. Eastern, I believe. You'll have to check the calendar, because I posted your week 3 announcement this week in Professor Kershaw's class. So I added the review schedule. Okay, so just double check that. Amari, why don't you stay on after? Okay, please. Okay, so let's go ahead and review the quiz. All righty. And then you have a couple of areas to take notes from, right? Some students like to print out the notes page that I send in the weekly announcements. It's essentially the PowerPoint, just reformatted with the lines on the right-hand side, right, to take notes. The other thing students do is they'll take their study guide, exam 1 study guide that has all the concepts listed on the left side and then a big open box on the right side. And they take notes in there as well. So you get a few places to take notes. Okay. All right. Hey, can everybody see my screen? Okay, so I like to do teaching from the quiz rationales as well. So it will take us a while to go through there, but it includes going through the quiz and teaching. All right, so this first question is about rural community. Before even looking at the question, what did you learn about the rural community? What is a rural community? What's a rural community?
A community with limited resources.
Yeah, absolutely. What else?
I kind of got like a country vibe, like where everything is like spaced out and you would have to travel to somewhere else to like stores and healthcare, like
Yeah.
and just finding a healthcare provider is hard because like that's what I got from the reading.
Yeah. What else? And by the way, let me just flip here. Hopefully everybody saw their readings. When you look in your syllabus or the modules and it says activities, right? You didn't have any book reading this week. All your reading was embedded into your modules, right? Everybody figured that out, right? Because I try and review this in week 1 when it says Canvas reading in your middle column for readings in your syllabus, right? When it says Canvas reading, that's embedded. So all 4 of these concepts were introduced to you in your module, right? Okay. All right. What else did you learn about rural populations?
That they don't really pay attention to their health like other people do. So by the time
Yeah.
they get to the hospital, it's
They
like
don't-
chronic.
Yeah, they're more
Exactly.
likely
Cute.
to have chronic conditions.
Yep. Awesome. Yeah. I actually live in a rural community. I'm way up in northwest Wisconsin in a very rural community, and it's all exactly that. And I've got to know the public health nurse that works in the county next to mine, and she actually covers 2 counties. And we talk a lot about rural populations, migrant farm workers, and all the things we teach, all the things I teach in this week about migrant farm workers and rural communities, spot on. So everything you're saying is true. So let's talk a little bit about vulnerability in rural areas. There's a lot. Okay, typically your population, a lot of under 18 and a lot of older than 65. Right? Residents tend to have fewer years of formal education and far fewer college degrees. It's amazing. It's estimated that 25% of the rural population live in or near the poverty line, and that translates into approximately 40% of rural children live in a impoverished state. Right? Most at-risk children in rural areas are kids that have racially or ethnic minorities, single parent families, typically headed by females. And one of the things you didn't mention that's true is very few rural residents have insurance or adequate insurance. That's a common problem as well. As you mentioned, rural adults are much less likely to prioritize their health care, engage in preventative activities. They're more likely to smoke, have higher rates of alcohol use, drug use, obesity, and less likely to engage in their screenings. Okay. It's estimated that 50% of rural adults have been diagnosed with at least one or more chronic conditions. Complex chronic illnesses is very common in the rural populations. So with all that said, the rural population tends to be in poorer health, right? They are less likely to seek medical care because they can't get to it. If you think about the rural population, you may have a primary care physician, right? Or a family physician. You don't have all the specialties. You know, if you have a high-risk pregnancy going on, you're going to have to travel to a high-risk OB. Neurology, cardiology, pediatrics, you don't have all those specialty services in the rural area, right?
How far is
It
the
depends.
travel? Like, is it?
So for me, if I needed
Yeah.
specialty care, I have to go about 45 minutes to the next big town. Okay, and that
So
varies,
that's
of course.
probably why they don't so often.
What? Well,
I said,
remember,
so that would make sense why they attend appointments often, because I mean, people don't attend appointments when they're in the same city, let alone driving 45 minutes away.
well, and remember, in rural populations, there's a lot of barriers, and those barriers are listed out in your readings, right? Transportation is a big barrier. What if they can't get to the cities for their appointment? A lot of rural jobs are low-paying jobs that don't come with insurance. They don't come with vacation days or personal days. So when somebody has to take a day off to go to the cities to see a specialist or go somewhere, they're not getting paid. Right? A lot of barriers. You know, internet, broadband barriers in the rural communities as well. Right? So it's getting better, but they don't have a lot of access to the telehealth services that seem to be so common. Right? So limited in telehealth, limited in specialty providers. Okay. So with all that being said, what should the nurse anticipate about clients in the rural community? What do we know? What do we know about risks, environmental risks? What'd you learn in your reading? They're definitely more likely to have environmental exposures, right? And they're definitely more likely to have complex chronic illnesses. B is incorrect. They don't have access to adequate access to physicians. And most of them will not have employer provided insurance. So yes, the beauty and the solace and calmness living in rural communities, is great. But if you're sick or you get sick, there's a lot of barriers. Okay. Let's see, is the next question? Okay, that's another rural question as well. Let me just check my notes here because there's a few other things I wanted to mention. Rural communities, maybe agriculture, remote farms, small town, small village. Right, we went through that. They don't engage in prioritize their health or preventative activities, which is why they're sicker. By the time you see rural residents, they're sicker. I think Taisha maybe said that, or somebody said that. By the time they get to your urgent care, they're well advanced in whatever's going on. The other thing that's pretty common in rural areas is violence. Domestic violence, child abuse, child neglect, assault, battery. Violence is pretty prevalent in the rural communities, as is drug use. I mean, I drive half an hour, 45 minutes to the next big city, and I pass signs all along this little highway that talks about overdoses, talks about fentanyl, talks about Narcan. I mean, everybody up where I live carries Narcan. So a lot of those issues, and typically we don't think, or you may not, you don't think about rural communities as being part of community or public health, right? Unless maybe you live in one, or you have a family member that lives in one, or a friend and you go visit or whatever. You don't typically think of the rural communities. You just kind of hear stories about them on the news and all the stories or all the impressions people have about people who live out in the rural communities, right? It's pretty, and think about it. Think if you're the community nurse working in a
I
rural
think
community.
something else you mentioned also was being in a rural town. It's so much smaller and the privacy of their information and being embarrassed.
I was just going to get to that. Yeah, I was just going to get to that. Another big barrier in the rural communities is anonymity. Okay, people sometimes are afraid to come forward to the urgent care or the clinic. Let's say there's violence involved, domestic violence, substance abuse, mental illness. They're less likely to come forward unless they have to, because one of the things that happens in rural communities, unfortunate, but everybody knows everybody's business, right? There's not a lot of privacy. So in those really touchy things, abuse, neglect, mental illness, families in crisis, much less likely to come forward until they have to. Right? And so getting back to, say you're the community nurse in this rural community, you may be everything. You may be the school nurse, immunization nurse, maybe the clinic nurse, right? You may be the labor and delivery nurse. You know, so if you're working in a rural community, that's what the first question in our case study talks about, is you're kind of out there. Got to bring all your tools with you. You may be taking care of pediatric patients, elderly patients, right? All different kinds of clients in the rural community. Okay, so the nurse is developing tertiary, right? We all have to know what primary, secondary, and tertiary is, okay? Because there's questions about all these three on all the exams and the HESI. All right, so we're doing a tertiary program. What's tertiary? I redid what was in last week's primary, secondary, tertiary question and just put back in the rationale, just so you would know. Okay, so what of these answers is tertiary?
Educate families on diabetes related foot care.
Yeah, why is it tertiary, Jasmine?
Because you educating them on something that they already got. You're not preventing it. You're not doing primary, you're not screening for it.
Right, they already have diabetes. Right? What's B? Primary, second, what's provide information on minimizing excessive pesticide exposure? What's that?
Primary,
Why?
because it is preventing.
Trying to be preventative. They don't have the pesticide exposure yet, right? You're trying to provide them information how to minimize it. What's C? Encouraging adherence to a routine pap smear. What's that?
Secondary,
Why?
because it's basically a routine that you're screening for cervical
Screening.
cancer.
Screening, right? Same with D. Organize a blood pressure screening at the local mall. Secondary. Right? So we have to have a good handle on this. And I want to mention, because it came up in one of my classes earlier this week, education. Okay, you can't just think that education happens only at the primary level, right? In the primary level, we're educating to prevent, right? But education also happens at the secondary level and the tertiary level. So don't be thrown off by an answer that says education, assume it's primary. We know of primary, we educate to prevent, but in secondary screening. So let's say we identify risk. Let's say we identify a risk of cardiovascular disease. We're still going to educate, right? We're going to educate that person on how to minimize or reverse those risks so it doesn't turn into tertiary. So we've identified a risk, but we're still educating. And then in tertiary, think about it, we're still educating, right? Because now they have something, an illness, an injury, a diagnosis, a condition. And look at what the answer is. Educate families on diabetic related foot care. They have diabetes and we're still doing education on how to help them care for their feet. All right, so that's just a tip. Don't get thrown off with education only being at the tertiary level, or primary level. All right, make sure I covered everything with rural populations. High risk areas in the rural area. Rural areas have a high risk of accidents, safety issues, okay? The most common industries, forestry, mining, agriculture. All right, have a high risk of accidents due to heavy machinery, motor vehicle accidents. They have a high risk of trauma, high risk of chronic illnesses we talked about. Okay, all right, so that's rural populations. Let's go and talk about the migrant population, which starts with question 3. So what'd you learn about the migrant farmer? Who is the migrant farm worker? Who are they?
Like, what do you mean by that?
Was it immigrants?
Okay, what do they do? Who are they? They're people that come here on temporary right? Temporary job sites to do maybe agriculture, farming, right? A lot of them are from, most of them are from Mexico. A lot of them are undocumented, right? But think about what they do. I mean, highly unlikely we would all have food on our table if it wasn't for the workers of the migrant farm workers, right? But it also comes with a lot of risks and health risks as well, right? A lot of times they're seasonal. A lot of times they bring their families with them. So then we have to worry about kids working out in the farms, what risks they all have, right? So what did you learn from your reading is the biggest risk of exposure in the migrant farm workers?
Pesticides.
Pesticides.
Yeah.
Okay. So when you're reading a question just like this, or you would do an exam, you got to identify your population. That's going to help lead you to the right answer. So our population in this question is the migrant farm worker. Okay, they presented the clinic with all these different things, right? So what do we think it is? What do we think they're presenting with? Since we know it's a migrant farm worker and we have all these things going on.
Acute pesticides?
Yeah, there's some kind of exposure, potential exposure to pesticides, right? We'll get into acute and chronic in just a minute. But all these symptoms, abdominal pain, nausea, vomiting, diarrhea, skin rash, eye irritation, throat, difficulty concentrating, those are all signs and symptoms of a potential acute pesticide exposure, right? Okay. We're certainly not going to be requesting a physician's order for an antihistamine. This really doesn't meet the qualifications to do a TB symptoms questionnaire. The next question will. Okay, and this certainly is way beyond conjunctivitis, right? And we know our population is the migrant farm workers, so we know they have a high risk of pesticide exposure, and that's classic. All these symptoms are classic of a potential pesticide exposure. So one of the things you need to know is the difference between what's an acute and what's a chronic. If you think about chronic pesticide exposure, that's over time. Okay, so look at the differences. Look at the acute symptoms here. All right, memory loss, concentration, mood changes, abdominal pain, nausea, vomiting, diarrhea. Those are all acute. But let's say you've been exposed to pesticides over months or years. Well, then you start looking at more permanent types of issues, right? Maybe reproductive issues, fetal development, long-term cancer, blood disorders, neural problems, maybe Parkinson's-like symptoms. Okay, liver damage, those are all chronic. So you'll get asked about this in the exam, given a scenario, right? Kind of like this question. Is it acute or is it chronic? All right, so please know the difference of both. Okay. Continuing on with migrants. Okay. One of the biggest issues they have is housing. Yes, they have a high incidence of pesticide exposure. But one of the other big risks is issues stemming from housing. Typically when they come, right, they may be living in very crowded housing conditions, very unsanitary-like conditions, okay? In your readings, it identified with this overcrowded housing of migrants, 3 different potential exposures, right? Hepatitis, TB, and GI issues, right? Remember that from your reading? So let's look at this question. The population is a migrant farm working family. They're living in a small house with numerous other people. What's our priority? Of course, we're going to try and do a TB symptom screening questionnaire, right? Because that's one of the big risks. The other answers don't even make sense. Okay, so let's read the rationale to support that. So when migrants come to the farm and work, they may find that the housing is not available or that it's substandard. Like I said, it may have lack of sanitation, structural defects, maybe mold, lead, it may be old housing, lead, broken appliances. Some migrants actually live in cars and tents. Okay, so when housing is available, it tends to be overcrowded. And then here's your 3 contributing risks: TB, GI, and hepatitis. Right? If they're living in older housing, they're potentially exposed to lead. Okay, and again, their housing may be located close to where they're working. So once again, the concentrations of pesticides, herbicides is going to cause them to be at risk. Okay. A lot of the risks and barriers to care with regards to migrants and the rural population are very similar. Right? Because typically, if you're working as a migrant farm worker, you're typically working in a rural community. Right? Couple things about migrant farm workers, right? Migrant farm workers come here to work during their seasonal, then they go home, or they move around to a different area, right? Typically, they don't know what services are available to them. There may be language barriers. There may be literacy issues, and I don't say that condescendingly. When we talk about health literacy, it's the ability to understand and communicate what's happening to you and be able to identify what needs to be done based on what's going on. So discharge instructions or plan of care. Health literacy is a real issue with the rural populations and the migrant populations. A lot of times within the migrant populations, there's a language barrier, right? And so that becomes a real difficult in communicating what's going on. Same kind of jobs. These migrant farm worker jobs don't come with health insurance, right? They don't come with personal paid days off. They don't come with vacation time. So if they get sick, again, they're hourly paid, daily paid. They run the risk of not getting paid, therefore may not seek out care until it's pretty acute. So same kind of issues. Talked about housing, migrants at risk for diabetes, dental issues is a big problem with the migrant population. And they suffer from a lot of the common health risks that rural populations do: chronic health diseases, obesity, mental health issues, depression, anxiety. And think about the kids working on the farms. Think of all the risks, additional risks that come to the kids, right? They've been yanked out of school, right? They may or may not have immunizations, poor nutrition, malnutrition, very susceptible to infectious diseases from the living conditions where they're living, maybe the working conditions where they're working. They're very at risk for that TB, infectious disease, GI, hepatitis. Dental issues for kids, immunization we talked about, pesticide exposures, injuries. Let's say they're working on the farms. How do you help protect and prevent them from injuries using equipment, hand tools? Very big risk. Okay. Constant mobility. There is what's called a Migrant Health Act. Okay. These are Migrant Health Act incorporates, I think, about 150 something migrant clinics around the country, located in 42 states. Migrants do have the ability to go to these clinics if they can get to them, number one, and if it's in an area where they're working. These are federally funded clinics that they can go to seek out primary services for all of them, the whole family, including the kids. Okay, so that's a plus if you're in that area where one of these clinics are. But if you're not, you're having to use whatever the local rural community uses. So they don't know about access. They don't know what's available. They may not be able to communicate. They have so many additional risks that we talked about. Pesticide exposures, injuries, mental health issues, substance abuse issues, a lot of the same as the rural community. But think about it. Think about how hard it is for them. Really hard. not only is their job hard, right, but then all the additional distractions or risks that come with that. We talked about pesticide, chronic, and acute. Okay, questions about migrant farm workers or rural populations. The rest of our questions talk about, in the quiz, talk about homelessness and poverty. Any questions? There's a lot of similarities. There are some stark differences, but there are a lot of similarities in the risks that both these populations face.
I just had one question. Do they have ambulance services? Like how, if they're in
Have what?
emergency, like ambulance services, how, if they're in a, is like a real emergency, how does
Yeah,
that work?
so up where I am, and I consider myself pretty rural, I only know this because I just joined the first responder team. I was pressured into joining it, but I did because I figured give back. I should. And just went through some training a couple of weeks ago, and this ambulance, the estimate was 25 to 40 minutes. That's a long time. That's a long time till you should wait for an ambulance. What can happen in that time? A lot. So I don't know if it's, I know there's probably a wait in every community. It may be shorter or longer depending, but for where I am, it was 25 to 40 minutes. Yeah. You know, like I said, there's pros and cons. You know, of living in a rural community. It certainly is peaceful and quiet, no question. But if you're sick or you get sick, you know, there are very, very real concerns. So good question. Good question. Anybody else have any other questions about those two populations? Do you ever feel like you have a better understanding of them? Yeah.
Also, another like downside of living in the rural community is
Oh, go ahead.
you
Go
have
ahead.
no cell service 90% of the time.
Absolutely. That broadband that I was talking about. Yes. Yes. I mean, obviously we have good broadband up here, but even when I'm driving down to the cities to fly home to Denver or something, you're always seeing road work and construction of them putting in cable, trying to put in cable along. So it's working. And if you look at the bottom, I think it's at the bottom of the rural populations reading page. You can see all the things they're doing to try and improve better access to healthcare, to internet. There's a whole list of things that governmental agencies, locals, there's a lot of work being done to improve a lot of things in the rural community. It's happening, it's just slow, you know? But yeah, Elizabeth, that's a great point. Does anybody, I always like to ask my class, does anybody live in a rural community? Does anybody have family that lives? Okay, so is what I'm saying spot on? It is, yeah. Yeah. Anybody else besides Elizabeth live in a rural community or have family and go visit? They're kind of off the grid if you don't think about it, right? I kind of feel like I'm off the grid, but it also comes with a lot of things. Okay, let's talk about poverty. So, which statement reflects, this is a poverty question, which statement reflects the impact of income on health outcomes? So let me start with this. The health of a family, the health of an individual. You can assess the health of a family, the health of an individual, by the financial status of the family. That's a fact. Okay, and what I mean by that is, let's say you're living in poverty, you're an individual, a family, maybe even a community. There are many communities that the majority of people live in poverty. Think about what that affects. Everything, right? Everything. From healthcare access, to insurance, to education access, to nutrition, proper nutrition, to, what else? What else does it affect? Maybe employment. What else does poverty affect? How would poverty affect people's lives, people living in poverty? What else would it affect?
I would think like it would sometimes when you live in poverty, you like it's like a higher risk for abuse in some ways.
High risk for
Nutrition?
abuse. What?
Nutrition?
One more time.
Nutrition?
Nutrition. Yeah, absolutely.
Stress.
High levels of stress. And what does levels of stress cause? Maybe abuse, maybe violence. What if you live in a community that has a high percentage of poverty and there's a high crime rate, or there are high gang issues, violence issues?
It broke my heart whenever you mentioned the infant mortality rate. Yeah, that was sad.
Now think about it. Access to care, access to proper care, right? Or education for teen pregnant moms that don't seek out prenatal care to the second or third trimester, right? So my point is poverty affects everything. Everything. Okay, whether you're an impoverished individual, impoverished family, impoverished community. And I saw this for years in the schools. For those of you that don't know me, I just retired from 22 years in the schools. I saw this over 22 years of the kids that were impoverished and lived in poverty. The challenges and the issues that these kids had as opposed to families not living in poverty was night and day. Night and day. And as a community nurse, being a school nurse, one of my jobs was to help families find the resources they needed to try and help them lift up out of that situation. So, which statement reflects the impact of income? All right, well, certainly we know that low income increases the risk of chronic illness, right? Because low income means that you are likely to have less access to healthcare, physicians, right? Low income reduces attendance to wellness visits. That's true. For many issues, maybe, a lot of times people living in poverty are just trying to survive day by day, right? They're not worried about getting to wellness visits. Maybe they don't have the transportation. Maybe they're working and can't get there. Okay. And then the other correct answer was low income does not improve health outcomes. That's true. Right? So let's take a look at the rationale. I may have already mentioned some things. Poverty leads to chronic stress. Poverty leads to mental health issues, high rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, more significant disability that comes from those complex illnesses, chronic illnesses, and obviously higher rates of hospitalizations. Okay. So for the complex chronic health problems, that certainly leads to high expenditures in healthcare. People may not be using primary care clinics. They may be just going to the hospital when they get sick, right? The other thing poverty affects is maybe your inability to pay for healthcare if you're self-pay. Maybe lack of insurance. Right? We talked about this with the rural population, but this really goes overall with people who live in poverty, unable to afford to take maybe they're not working or have a low-paying job that doesn't have insurance, so they're unable to take the day off to travel to go get their health problems looked at. Low-paying jobs often don't provide health insurance, right? Then the next question has some more information about poverty that we'll go through. So what should the nurse anticipate for a family living below the federally defined poverty line? Okay, well, you're going to have much poorer health outcomes. That's obvious. right? You're gonna have increased vulnerability due to lack of insurance. You probably don't have insurance. Right? And you're also going to have increased vulnerability due to fewer community resources. I mean, you would hope the community, every community is different. You know, I don't know, think about your own community that you live in now. Are there a lot of resources for families, individuals living in poverty? I don't know. Right? But the less amount of resources you have, the more your vulnerability increases, right? And so this is just a quick rationale about whether I'm not sure if you know it, but poverty is defined by the federal government, right? They have poverty lines. Okay, this is from 21, but the statistic I took was making a certain amount of money, you're at the federal poverty line. Okay, eligible for resources, TANF, public housing, food stamps, Medicaid, WIC, right? Head Start. Those are just some common across the country federal programs that you become eligible for. Think about individuals or families that are just above that poverty line. Not a lot, but just above it. They lose access to all those resources. So think of how vulnerable they are. Yes, by the federal government's numbers, they may be above, but maybe only slightly. So that is in itself a whole nother vulnerable population. The people that live below the poverty line and just as vulnerable are people that live slightly above it. Does that make sense?
I have always said that, like, even with like childcare, like, you know, if you make a certain amount of money, you're not eligible. I
Mhm.
really found that to be problematic, especially for people
Yeah.
that's trying to do things, you know, for themselves,
Yeah.
but they can't get the adequate help and they're not making like they're making, you know, so much money. But I have always thought that was an issue.
Yeah, totally. Here's a couple of statistics for you. Before the pandemic hit, the percentage of Americans living in poverty was the lowest it had been since 59. It was at 10.5%. After COVID, it climbed to 17%. That's a huge increase over a couple of years. And after COVID, the child poverty rate is right now is standing at about 22%. 22% of kids live in poverty. Those are the estimates. What is poverty? How is it defined? Insufficient resources to meet your family's basic needs. Okay, those basic needs include food, shelter, transportation, and healthcare. Okay, contributing factors to poverty. Talked about some of these: unemployment, loss of retirement benefits, maybe loss of 401ks if you got laid off. We talked about poverty leading to chronic stress, mental health. That was one of our rationales. Young kids, here's something really important. Young kids, children are at the highest risk for effects of poverty. Remember that. That is a fact. Kids are at the highest risk. It's not that others aren't. It's not that the elderly are not. They are, but kids are at the highest risk. Okay? Poor nutrition, poor brain development, exposure to environmental toxins. Let's say you live in an area. We'll talk about this later in the term when we talk about environmental exposures. But let's say you live in an area that is industrial or near I want to call it a dump site or waste site. You live near power plants. You live near a big transportation hub. These kids are exposed to all these environmental toxins from the simple area that they live in, right? Kids are exposed to trauma. Kids are exposed to abuse. Kids are exposed to lower Maybe lower education standards. As Taisha said, maybe lower quality daycare. Okay, these kids have more chronic illnesses, and I saw this in the schools over and over again. Definitely more chronic illnesses, more nutritional deficiencies, more growth and development issues, developmental delays, behavioral issues, academic issues, definitely more infections. Okay, and these kids are usually stuck in the poverty cycle due to just the lack of opportunity, right? It's tough. It's tough, but if you're out there as a community nurse, you will be working with people who live in poverty, whether they're individuals or families or a subset of the population. Which client is oh, I just kind of gave this answer away. Which client is at the highest risk for adverse health outcomes related to poverty? Well, I just told you, kids. And this one doesn't even have a medical history, so they're doubly at risk, right? So what's important about this is a good example of a question that you may get in a quiz or an exam, where one or more answers looks like it could be correct, but it's not a select all that apply. What do you do? You go back and read the question a second time and see what word or phrase you missed. What did you miss
Well,
here?
I know I broke some of these down like, hold on, let me see. Wait.
A lot of people pick the older person. Okay? It's not that that's not incorrect. They have a high risk of the elderly person has a high risk of adverse health outcomes related to poverty. But the question is asking who is the highest. So I'll stop here and do a quick exam strategy. Do you guys use the highlighters in ExamSoft? There's a highlighter in ExamSoft, right? That you can go in and highlight keywords, phrases, important information in the question. Okay, so here you would highlight highest, right? And then I don't know if you should know about the resource that my students describe as the eyeball. And that's where you can go in and cross out answers. So if you know that an answer is not correct right off the bat, you can scratch it out. Okay, so that when you go back and read the question for the second time, which I know you all do, you will have highlighted information and you may be down to 2 answers or 3 answers. And if you don't use those resources, I've had feedback from students for term after term that they use those and they're very helpful. Okay, so that's my exam strategy for that kind of question, right? Because I don't know what's the difference between the 15-month-old and the 68-year-old. They seem pretty vulnerable to me. But knowing now what you know, which is children have the highest risk, that would lead you to the 15-month-old. Make sense? And here it is in the rationale. Children at the highest risk for effects of poverty, lack of adequate nutrition. We just went through all that. Yeah, we just went through this rationale. Okay. Okay, let's talk about a impoverished adolescent. So that would be a teenager living in poverty. What would the school nurse expect from an impoverished adolescent? What'd you read? What'd you learn in your readings?
Unplanned pregnancy.
Unplanned pregnancy. Well, if you look at the other answers, they don't make sense. They have an increased risk of dropping out of school, right? They're not going to have improved attendance at extracurricular activities. It's not. It's going to be the opposite. And if they're an impoverished adolescent, they're not going to have excellent use of adaptive coping mechanisms. In fact, they're going to be pretty challenged, right? So really, the only sensible answer here is the risk for unintended pregnancy, and that's true. Poor teens are more likely to have below average academic skills, 3 times more likely to drop out of school, higher rates of teen pregnancy, more likely to suffer complications from pregnancies, whether it be late prenatal care, no prenatal care, a low birth weight baby, preemie babies, and maybe even babies with issues with birth defects. Poor teens are very vulnerable. Okay. Then the last 2 questions are about homelessness. Make sure I covered everything for. Okay. Homelessness. This is a tough subject. Okay. We all have to. Does anybody work with homeless population? Okay. One other thing you'll hear me say this as we start really getting into vulnerable populations in this class is you really have to check your own feelings. You are not going to be able to competently and culturally care for this population unless you can do it in a non-judgmental, compassionate, open, listening. That's how you have to be. Okay. Most people don't choose to be homeless, right? And they're there for a reason. Everybody has a story, whether it's an individual, whether it's a family. Everybody has a story or has a story of how they got in this situation. And it is imperative for us of nurses to hold our judgment. We need to be as helpful and resourceful to this population because we're trying to lift them out of this situation. Right? Who can become who makes up our homeless population? That's a question for you guys. Who makes everybody? Everybody of all walks of life, right? Age groups, gender, races, ethnicities, even occupations. Everybody makes up the homeless population. Right? So I started talking about, let's just jump to the rationale before the question. As nurses, it's vital that we respect the individuality of every person. Many factors can contribute to homelessness. Many of us are only 1 or 2 paychecks away from being able to maintain our own housing. It's easy to stereotype, but guess what? Often we're going to be wrong. Okay? And when we're wrong and we stereotype, we're going to destroy any chance of developing that relationship that has to happen right off the bat. Okay, the initial meetings, the initial encounters are the most important with this population, right? Trusting, caring, compassionate, empathetic. They need to be able to trust you. That's what we call therapeutic communication, right? Can't make any assumptions. Let them tell us their stories. Learn who they are, how they got there. Right? This is going to be the trusting initial relationship is the only way we're going to be able to help guide them. Guide them with some resources, guide them to some sort of stability. I saw this during COVID when school was closed and we finally came back a year later. It was amazing the number of families that had become homeless during that pandemic time. Whether it's parents lost their jobs, or parents had to quit their jobs to stay home with their young kids. The increase, they estimate, I think it's in one of your readings, estimate over 600,000 people are homeless on any given night, and 1/3 of that is families. That's a lot. Okay. So, how did they get there? Who knows? That's something we have to find out when we start meeting with them and trying to get them the support they need. And I spent an entire school year when we got back to school working with homeless families, trying to figure out what resources they needed, right? To keep their kids in school, to keep them in a shelter. And what do we mean by homeless? Homeless isn't just living on the streets. Homelessness means you really have no place to be discharged to. So no permanent address. So you can, a family, I had a lot of families that had moved in with relatives, right? That's still considered homeless. They have no place to go after that. Or living in shelters. They have no place to go after that. That's considered homeless. We tend to think of homeless as people living on the street. No. Nope. What's common with the homeless population? Very common, most common, mental health issues, substance abuse issues, right? And what else is common among homeless populations? Infectious diseases, TB, violence, abuse. What else did you learn?
Did you say mental illness?
Mental illness. I said that right off the bat. Mental illness and substance abuse are the two most common issues.
Didn't they say something about like they had like bad foot care or like
Skin issues, heat related. Think about it. Heat, cold, in the winter, living on the street, frostbite, skin issues. Right?
Hepatitis.
Hepatitis, infectious diseases, very communicable infectious diseases. Trauma, a lot of cognitive issues, TBIs. What else? What else may you find it when you're doing your assessment of the homeless population?
More chronic.
More chronic diseases, right? And think about it. What these people aren't going to neighborhood clinics, right? They don't really even know what's available to them for resources, right? So where do they seek their care? Why is
At the hospital?
Yes, I was going to rephrase that question and say, why is homeless healthcare so expensive? The most expensive population to take care of. Why?
Because
Because
most people have insurance.
Go ahead.
Well, yeah, they don't have insurance, but where are they going?
To the emergency room.
To the ERs. Where's the most expensive place to get care?
ER.
ERs. Exactly. That's why it's so expensive. Trauma, gunshot wounds, stab wounds, violence, head trauma, a lot of suicide in the homeless populations, right? Here's a pretty
Sexual, well, STDs. Would that be one?
STDs. Yes, absolutely. Here's a really, really sad statistic. The average life expectancy for a homeless individual is 44 as opposed to 78.
For real? 44?
44.
Wow.
Mhm. So here, let's look at this question. Number 9. Who's at the highest risk for homelessness? Why is it the veteran and not the It's not that all 4 of these answers are not at risk, but the question is asking who is highest at risk. Who's that?
Because
And
they're
why?
living alone.
Exactly. There's no support system around them. They're living alone. That's the key. Yes, a
With
kid. What? Yeah,
living alone with a mental health issue.
absolutely. I mean, obviously, all these other 3 are at risk, but the kid with childhood suicide ideations is in therapy. Hopefully, a support system around him or her. The adult living with schizophrenia in a group home, hopefully a little bit of support around that. And then the adolescent living with substance abuse with a supportive family. So it's a stark difference of a veteran living with PTSD alone. Right? We already covered that rationale. And then lastly, the nurses working with the homeless population, what might you observe? We already talked about all these: crowded, unsanitary living conditions, substance abuse, mental illness, chronic diseases. All right, so we know, I already explained this, but I always get ahead of myself. I must have these rationales memorized or something. Homeless includes those in the street, but those staying with friends, relatives, staying in shelters, staying in institutions, nowhere to be discharged to. Homelessness sometimes can be intermittent, meaning you're in and out of homelessness, right? It's hard to estimate the numbers. We know that homeless people are exposed to the elements. We talked about that. Crowded, unsanitary conditions, malnutrition, lack of sleep, chronic stress, more likely to abuse substances, have mental illnesses. Here's what you guys all brought up: TB, skin infections, chronic illnesses, be victims of crime. Okay. Make sure I covered all of what I wanted to cover. About that. Yep, I covered it. Okay. So, in the interest of time, right, because we don't take a break, so well, you should be done 10 minutes early. I know we didn't get to the case study, but here's what I'm going to do. When I send you the recording for the class, I'm going to send you the instructor version of the case study, because it goes through the case study, the questions, but it does have the answers on it and the rationales. Hang on. Let me pull this up real quick. There. Okay. Whoops. Send that back down to you. Can you see that? That's where you're going to be getting. It's called Rural Health and Migrant Case Study. It goes through, ignore the top. You don't have to worry about that. But here's your case study. These are questions we're supposed to talk about in class, but we kind of go through it. Here's your case study. So read through the case study. There's 3 questions. It's actually, it reinforces what we talked about today with migrant and rural health. So go through your case study, has 3 questions, gives you the answer, but what I want you to focus on is the rationales. And I'm a big believer in rationales for learning. All right, so I'm going to send this along with the recording. So I would encourage you, it's not required, but I would encourage you to have a look at it. It just reinforces everything we talked about at the beginning of class. So let me double check. I have 2 chats. Oh, restroom breaks. Okay, so 2 minutes over. Sorry, I apologize. I hope you have a better understanding of these 4 vulnerable populations. Any questions?
I would love to stay for your review, but I have peds right after this.
Okay, well, I'll be sending out it's not for a half an hour. I'll be sending out the recording tonight, hopefully. But please take a look, please take a look at my review. Okay. So I kind of fill in the boxes, your blank boxes. I know it's blank for you guys, but I kind of fill it in with, make sure you review this, make sure you review that.
Do that. Okay.
Yeah.
Yeah. If I have any questions, I'm not in your class. I can contact you.
Yeah, absolutely. So listen, I know it was a big class. I know we covered a lot. I appreciate all of Professor Kershaw's students being here. And if anybody has any questions, I'll be happy to stay on. But I hope everybody has a fantastic weekend. And if you have any issues studying for the exam, you got to reach out to us next week. You guys don't go till next Friday, so you get all next week. So as you're preparing, if you're struggling with any of the concepts or need to talk about any of the concepts, you got to schedule a time with us.
Thank you.
Professor Marvel, it's at 6 or we're just staying on for it. How does
No,
that work?
I have to get off off this Zoom so that this can record for the class. And then in 25 minutes, I'll start a new Zoom for the review.
Okay, and we have that information in our stuff already.
Yeah, it's in your week 3 announcement. Well, you're coming right back to my Zoom. This is my Zoom.
Okay.
So we're coming right back here.
Professor Marvel, will we get the same concepts